Okay, it's 5 past, so that's probably the prerequisite amount of time and we can get started. So welcome to tonight's RAC Forum on global refugee politics amidst the threat of COVID-19. So we'll start off, of course, by acknowledging that those of us who are joining us from Australia, at least, are all joining on Aboriginal land, and that sovereignty over that land has never been ceded, and that the struggle for land rights and self-determination continues, which is something that I think we as RAC believe is intimately intertwined with the struggle for refugees to have freedom. So tonight we'll be discussing a few different aspects of global refugee politics amidst the COVID crisis. And of course that's very relevant today after the very scary news that one of the guards in the Mantra Hotel, or one of the staff members there, has tested positive for the virus. So, you know, that thing of detention being an infection risk really is more significant now than ever. So we've got 3 speakers who we're very lucky to have tonight. So first of all, we'll hear from Abdulaziz Adam, who is a refugee who spent almost 6 years on Manus Island, and was really one of the key activists and spokespeople in the camps who spoke out about the abuse perpetrated by the Australian government. So we're very lucky to have Aziz. And of course, people will know that Aziz has since, you know, won a Human Rights Award in Geneva and was then finally granted asylum in Switzerland. And since then he's sort of travelled and around Europe and seen some of the conditions of refugees in the camps over there, where there's also a very serious COVID threat. So we're looking forward to hearing from him about that. And we're also very lucky to be joined by Ben Windsor and April Tafe from Adds Up, which is a refugee support network for ex-Manus and Nauru detainees, and it's run by a group of Australian expats in the US and Canada. So we've got Ben, who's the co-founder of that organisation based in the US, and April, who's part of the Adds Up team in Australia. And they've been assisting refugees resettled in the US, and they're currently helping a number of refugees with serious, you know, underlying health conditions who very much are in that at-risk bracket with the threat of COVID-19. So before I hand over to them, my name's Tilly. I'm from RAC. I'm a RAC member, and I'll just briefly explain a bit about the situation here in Australia and the rallies and the resistance that have been happening around that. So for those of us who don't know us, RAC, Refugee Action Coalition, is a grassroots activist organisation campaigning for the rights of refugees and asylum seekers here in Australia and in the camps offshore. So yeah, we organise rallies and forums like this one tonight, and we have weekly meetings which people are very welcome to join, and we'll post in the chat about some of our upcoming things that we're doing soon. So I guess a bit of the context of what's happening here with COVID. People remember the Medivac process, which has had a number of people brought here, but instead of being free in the community and with, you know, proper access to health treatment, they've been kept in Mantra Hotel in Melbourne and Kangaroo Point Hotel in Brisbane. And, you know, since the COVID crisis, both hotels have become quite serious sites of protest and activism from the refugees inside who've been speaking about the threat of infection risk. And that's, you know, culminated in quite significantly large demonstrations in Brisbane in the last couple of weeks. And there'll be another one of those demonstrations in Sydney, Melbourne, Brisbane, possibly some other places as well this Sunday, the 19th. So we'll talk a bit about that later. But yeah, we've very clearly seen photos from inside the hotels that social distancing is impossible there. And of course, we know that the people who've been brought here for medical treatment, you know, many have asthma and other conditions that would pose really serious risks if they were to contract the virus. And we know that there's hundreds of staff coming in and out of the hotels. And with the news of a staff member contracting the virus in Melbourne, I think that risk is now quite scarily close. But, aside from the threat of infection risk, there's the aspect that we always talk about, which is just the very serious and physical and psychological risks posed by detention itself. And just COVID just brings it into even sharper focus, that we have governments that are very, very dedicated to placing racist immigration policies before health, both the refugees' health and the health of the rest of the community. The staff going in and out of the host hotels, their families. So all this unnecessary risk could be eliminated tomorrow, in fact, by releasing people into the community. So I guess that's what we've been campaigning for to free them and let them stay. And so we'll have a protest this Sunday in groups of 20 in Sydney. There'll be similar protests in Melbourne and Brisbane. And we'll talk a bit more about the logistics of that later on. But first, we'll talk a bit about the global perspective of the COVID crisis. And I'll hand over to Aziz first. Thank you, Aziz. Ah, there we go.
Sorry.
No, I think that was me.
All right. First of all, thank you very much, Mapia, for the introductions, and thank you very much for this opportunity. It's been a while since I've participated in any of the Zoom call, especially about the crisis on the Australian sites, but I did a lot about the European sites. But first of all, let me say a few things about the crisis, and then I will jump into the cases of the guys on Manus Island. I mean, the COVID-19 crisis, it's not I don't think it's something new, but I feel kind of like it's a reminder for all of us. I mean, it's a reminder of how and what exactly the refugees are been talking about for years and years and years and years. And today, as we see the number of the refugee, it reached up to nearly 80 millions of refugees around the world. People like displaced people or people in move, they call them, according to the UNHCR term. And the reason why I say reminder is because we have witnessed what happened when the war in South Sudan torn apart. We have seen how people were really, really, moved away from their own country. And it can give us an example of what happened exactly today with the COVID. And also it's a reminder of what is happening in Libya, and it's a reminder of what is happening in Syria. So what we are experiencing today, from the perspective of the refugees, or a migrant perspective, it is not something that we can really preoccupy with, but it's just something that we can just use it as a leverage to remind people that, look, you are reminded, you are welcome to know what happened. What does it mean to lock someone down in a detention center? What does it mean to someone to rip him apart from his own liberty of movement, of his speech, of everything? And you lock him down for like places in like Manus Island for 60 years, or in any other detention centers. And on top of that, today also we've seen that, and we are witnessing, as I'm based in Europe, that Australia become a symbol of inhumanity. And I'm sorry to say that, but that's the fact. That's how even some of the European countries are referring to Australia policy. We have seen today Americans, although the offshore detention center originally it's an American idea, but then Australia copy America, and then now today America trying to recopy Australia again. But what happened in Europe here, Europe is one of the continents that we have seen lately, there's a lot of crises going on. We have a crisis today in Greece. I have been there, back in February of this year. We have a crisis in Calais, France, where I have been, and I have seen how the crisis and how the authority were trying to handle the situations. And as well as I've been hearing a lot of news from what is happening in Italy. So on top of that, today we have seen some of the Europeans are proposing to their own government that we should try and, I mean, replicate what Australia did to deprive people from coming to their own countries. But the danger is that there is a big mistake is going to be, I mean, it's going to take place by these peoples, I mean, especially by the governments. If you try to replicate Australia, you have to be careful, you have to be very careful about what you're trying to do, because they haven't had any chances to speak with the people who came out of the Australian detention centers. And based on what I did, based on my activity, I tried to speak in many events, and I tried to put things together just to give a people like a bigger picture of what is happening there, so that at least we can avoid, I mean, copying Australia. We can always come up with another solutions, a solution that will reduce something called an offshore detention centers, a solution that can be easier and allow people to access to a very, I mean, a temporary protections, like for instance, like a visa, temporary protection, people can access, people can travel rather than risking, I mean, a pregnant woman, rather than risking her life, I mean, and her baby to get in the boats, or the children, or the minors, or even the vulnerable people, the old people, rather than getting on the boats, which will always have this kind of platform is opens. And the COVID-19 in Europe has changed everything. I mean, what does that mean? It has changed the perspective of even the Europeans. Personally, I was hoping to see that how the European will react with the COVID-19, I mean, a measure or the lockdown. But unfortunately, what they did was they have locked down their countries, and they raised something called the nationalistics, which means that my people, my country, and I don't care about other peoples. This is what we have seen in Europe during the lockdown. No one really intend to even to talk about refugees. All we have seen is people who are really talking about themselves, which is, okay, my own peoples. But on top of that, what is really, really, I mean, unacceptable was we have been told by the authority to stay at home. And when you say home, what does that mean? Home is, for someone like me, home is something that we've been dreaming for years and years and years. And we've been crying and raising our hand to see people, to reach out to someone at least can give us a tiny space to say home. Home for someone is a homeless, it's just the streets. Home for the sick people, it's just either the aging house, I mean, the aging care, or somewhat other places. But what happened was the COVID-19 has, I mean, extremely make things visible between rich and poor, between refugees and the citizen, between documented and undocumented, between healthy and unhealthy. And the victims, who are the victims? Number one, refugee. Number two, refugee. Number three, refugee. And number four, they are homeless. Why I say that? Because refugees have no place to stay. Refugees have no house. Refugees has no space. And I can say that even I seen today in Australia, 90% of the cases of the Medivac who were now in the hotels in Australia, I assist in their cases. I play a major role before I leave Manus. And I can assure you that 80% of those people who are suffering from a disease that which can lead them to lose their life if they are still locked up in that place, or if there is any pandemic, I mean, breakdown in that place. And as a matter of fact, today, when I woke up and I received the news that a guard has been confirmed he's a positive. And that means he's going to risk the 80% of the people who are really with the diseases that they are in a red line to lose their life. He's going to risk their lives. And as you say, the only solution, Faye, is to release these people in the community. But releasing these people in the community, it's not enough. It is not enough. But at least one thing that we could do one thing at a time, which releasing them to the community. I can give you another example. In Moria, I mean, despite I've been on Manus for 6 years, and despite of what I've been through, I mean, from mentally, physically, and I can say that according to the terminology of the UN, it's a torture. Whether you believe it or not, it's a torture, psychological torture and physical torture, which lead to a loss of life, and which leads to a damage, physical damage, and which leads to a people with the permanent, disability. That's what the outcome of Manus. But the outcome of Moria, guess what is that? 22,000 people who were locked up in a place that less than size of the detention center of Manus. Less than size of the detention center of Manus. No food. And if I say no food, which means that there's no food. There's only a food that where 22 people have to stay in a line for 3 hours to access to a one meal. There's no medical cures. And this is the second place on the planet that where I see Médecins Sans Frontières, which is a doctor without border, who are not allowed to have an access, which is why I say the second place, because Manus was the first place. Manus was the first place where the doctor without border were not allowed to come and assist, and Moria became the second place. Why things are coming one after another? Because of the Europeans have did their research, which is a digging deep down into what Australia did, what measure Australia has took to deprive and to expose their inhumanity and their cruelty. Especially when I say Australian, I mean the governments. I'm not targeting the people, I'm talking about the governments, what they did. And the European comes out, they've seen the results of what Australia did, depriving UNHCR agency from accessing to the detention center for the 3 years from 2013 until 2015. I remember that exactly the date and the time, what time they come to Manus, depriving Red Cross from coming and access to the center. All of these things we are seeing today, it's happening in Moria. And as a matter of fact, why are we blaming ourselves? What we need to do is, it's a solidarity. And when I say solidarity, it's not the solidarity that we are seeing today in the COVID-19, because the solidarity of the COVID-19 is a fake solidarity. It's a solidarity that refers to the nationalistics, which refer to the Australians as an Australians. It's not the solidarity that's going to include the refugees and migrants. The solidarity that I say is a fake solidarity because I've seen it in Europe, which including only, when you say Switzerland, it's only for the Swiss people. When you say Netherlands, it's only for the Netherlands people. Germany is all, there is no refugees has been included in this solidarity. So what we want is an inclusion. It's not an exclusion. An inclusion with the roles of the refugees to play in front, with the involvement of the refugees and with the contribution of the refugees. And let's remind ourselves, what we need to do is, we need to start it in Australia before even in Europe. Why I say Australia? Because Australia is the beginning, despite this country has got a very good record in human rights back in the days, especially when we talk about refugees. But that record started to, deteriorated from 2001. And I can say from 2001 why I went all the way back, because I remember the Tampa situations, which is the ship of the Tampa situation. From that moment, the situation started deteriorating. But things are really falling apart. So what I'm asking for all the viewers, that each and every one of us has a role to play. Each and every one has a role to play, because those people who are in the detention center today, we are only a few days away from the anniversary, the 7th years anniversary of the 19 July. And the policy that like someone like myself and many other hundreds of others who are still on Nauru, some others still in Port Moresby, this is the situations. But also want to remind you that when we heard about Manus, it's over. Yes, Manus is over, but there's no solution. But we still have 4 guys who are still on Manus. I think many of us who don't know, even when we say Manus is over, people were like, oh, Manus is over, people are in Port Moresby. No, make no mistakes. We still have 4 people on Manus, and we don't know what is their status. They are, left there on their own, and they don't know even where they can go, what to do. And I'm personally in contact with these people every day just to make sure. Why I do that is because I'm trying to give them hope, but also I'm trying to remind people that let's not forget. So, solidarity. And let's make this solidarity as a solidarity, the real solidarity. It's not a solidarity that can exclude refugees. And the migrations and refugee crisis, it's not a problem. I don't think it's a problem. It is a human reality. Why can't we face this human reality with compassion and open hand, rather than just using it as a political maneuver to say, okay, you are, I mean, Labor, Liberal, left, right, or Greens or other parties. It's become like a political talk. And when things turn to a political talks, we always end up seeing that lives of humans will be lost, and we're always seeing prisons will increase, and we're always seeing offshore detention, and then the private corporate, or like the private companies will jump in, like a Wilson security guard, G4S, who jumped in, or Circle. They are making profit out of the human misery. So what we need to do is to cut all of these things apart. We need to make sure that a strong solidarity with one purpose. The purpose is we want to end this. And if we end it there in Australia, it will end all over the world, because this is where it started. Thank you very much.
Trying to do the clapping reaction. Thank you so much, Aziz. That was very, very well said. And we absolutely agree. It's, yeah, we need to build the kind of solidarity that doesn't give a shit about ScoMo's, you know, nationalism and all their talk of Australians are all in this together. It needs to be a solidarity that goes beyond borders and fights for refugees here and overseas. Thank you, Aziz. So I'll hand over now to Ben first. Ben Windsor. There you are.
Thank you so much, Tilly. I appreciate that. And thank you, Aziz, as well. I think I'll start by just kind of laying out what Adds Up is. As Tilly said, we work in the United States. There are now about 800 refugees from Manus and Nauru and from community detention in Australia who have arrived in the United States. And when we started 2 years ago, we kind of thought of ourselves as a group of Australians, a group of Australian expats in America who would kind of fill the gap with the American Resettlement program, provide that kind of welcoming face to meet people, support people, give them a bit of extra support, and to kind of leverage the Australian diaspora. There are about 100,000 Australians in the United States, and they all know what it's like to move to a new country, to resettle, to rebuild a new life, because they've done it themselves. So that's kind of an instant point of connection. But there's also a strong sense of solidarity among Australians with each other, helping new arrivals. And we kind of were hoping to tap into that to help new arrivals from Manus and Nauru as well. And it worked incredibly well. People really wanted to step up. People were meeting people for coffee, catching up in the new cities, going to job interviews with them, helping them with resumes, and just kind of helping them with those first steps of rebuilding a life, which is, of course, so difficult after all those years in detention and the trauma that follows from that. What we saw over the next 2 years was really the collapse of the American resettlement system. The Trump administration has cut the numbers, which has also meant a severe cut to the funding of the resettlement organisations that are supposed to help with the first 3 months of arrival and to set people up for success. So that's been, over the course of the past 2 years, pretty much decimated to the point where it's really just a very skeleton system right now, a very basic minor support. And that's where it was at before COVID-19. And then COVID-19 struck. And as Aziz was saying, really refugees are on the front lines, among the most vulnerable people. And that's true in America as well. These are people who have managed to find minimum wage jobs, often in service and hospitality industries, which of course were the first jobs to go. Often they're not eligible for the full suite of government support that has come out as part of the COVID-19 relief package, which already was quite minimal. And many refugees are not finding themselves eligible for that. And even if they are, it takes so long to apply, and the American systems are so bad right now that you could apply, you could go through all the paperwork, and then it could still be months before your first stimulus payment comes through. So it's really been quite a desperate situation for the people who have had established lives in the US, only to see it kind of fall apart. And it's been especially difficult for new arrivals, for people who arrived just before COVID-19 and for those who are still arriving now. they're eligible for even less support from the government. The resettlement agencies, in some cases, have all but abandoned them, kind of just dumped them in an empty apartment without even groceries and maybe given them $50 if they're lucky, and have been just really, really neglectful in terms of supporting them at the beginning. And of course, for someone who has spent so long in detention or who has been in community detention in Australia, to arrive in America, to have freedom for maybe a week or so and then be forced into a lockdown. And then once the COVID-19 lockdowns are over, the curfews start coming in because of the riots and protests related to the George Floyd killing. It's been a real nightmare for refugees who are arriving now. We've had a lot of amazing volunteers and donors step up to help people through this and to guide them and support them through this and to fill the gaps, which are now bigger than ever. And perhaps April, who'll speak after me, can speak a bit more about that, because she's been really working on the ground in coordinating volunteer support, in listening to refugees and to trying to figure out what they need and trying to find ways to help them as well. And just before I do hand the floor over to April, we also support the sponsorship of refugees in Canada through Canada's private resettlement program. And that is quite a complicated process of both filling out a very detailed application form with the requisite IDs and documents and a compelling narrative that will be accepted by the Canadian authorities to sponsor refugees who arrive there. We work with the UNHCR and with partner groups in Australia to make sure that cases are being prioritised. We also have to raise quite a bit of money, about 17,000 Canadian dollars per sponsorship, to kind of set them up for success when they arrive, and also build a team of resettlement volunteers in Canada of 5 people per group to be able to sponsor the refugee and support them through that, their first year of arrival. And so we've been working on kind of using that model that we built in America of getting the Australian expats involved in doing that to Canada as well. And it's been very successful. We've had dozens of applications submitted, and we're hoping to do a lot more. At the moment, I know a lot of people are very interested in the progress of the Canadian program. The government currently has a pause on it, as a lot of refugee resettlement programs around the world are paused right now because of COVID-19. We're not sure when that's going to start up again, but we're hopeful that things will move soon. And I believe that while kind of applications are slowed down right now, they are still slowly progressing. People are still getting a few updates on what's happening there, but there is a lot of additional uncertainty with the Canadian system now, which just means it's all the more important to advocate for the safety and security of refugees who are in Australian detention and are still in detention on Manus and in PNG and on Nauru as well, because there just seems to be no quick answers for anything other than an Australian-based solution right now, because it's just made all of the third country resettlement options all that much harder. And as we're seeing in America right now, it's really not ideal to be dumping refugees from Manus and Nauru into third-party countries. So if April would like to speak more, yeah, thank you so much.
Thanks, Ben. Just finding April's unmute button. There you are.
Hello. Hi, everyone. Yeah, my name's April Tafe, and I've been working with Ben Windsor and the rest of the Adds Up team since sort of its inception in May 2018. So I was also an Australian expat living in the US, and heard about this group of Aussies that were going to band together to help welcome new arrivals to the US. Look, it's been an incredible journey working with this group of incredibly resilient people, hundreds of whom have come out of desperate situations into a country that, you know, has little to no social service support, and trying to find good Australians to help build community around them. So you know, since the onset of COVID-19, we've seen not only people affected personally by COVID, families, households, friends and households being affected, and seeing amazing Australians step up to provide support. So look, we do our very best with the resources that we have, and advocating with case managers as well, who, like Ben mentioned, have very little resources and have been quite negligent as well at times. So look, we really appreciate all the support of Australians in the US and in Australia that continue to not only provide local support but also virtual support. We're very lucky to be set up properly as a virtual network before COVID-19 came along. So now that we have the means to, you know, we have a network of about 2,000 volunteers, I think, is that right, Ben? Across the US, who offer all sorts of services and support, which is amazing. We also, you know, we've been working with beautiful Canadians as well in Toronto and across Canada, and Australian community groups here who have helped us raise money, which has been very heartening. And you know, we hope that that program is able to pick up again soon. But yeah, that's about it for now.
Thanks so much, both April and Ben. Yeah, it's very, very significant and important work that you guys do. And I think it's also a very important point that you make, that, you know, the issue is coming from the complete lack of a resettlement process in Australia, and that's people are relying on US resettlement, which is clearly not the way to go. So yeah, we've been saying it for some time that US resettlement is not what the government should be talking about. They shouldn't be talking about third country solutions. We should be talking about bringing the refugees here. So we'll have a bit of time for discussion and for questions. Before we do that, I'll just post some links, or I think someone will post some links in the chat for, first of all, our rally this weekend on Sunday. So because of social distancing, we'll be doing this rally in groups of 20. So it'd be really great if people could use the registration link in the chat just there, and that allows us to distribute people across separate locations, so that we're better able to comply with the social distancing. So if you sign up to that link, we will contact you and let you know. It'll be 4 locations in the CBD, which will converge at Town Hall, so they'll be very close to Town Hall. But we will need to meet separately, so please register via that link. And there's also protests this weekend in Brisbane and Melbourne, which I believe people have also been posting about in the chat, which is great to see. And of course, this weekend is significant because the 19th of July marks 7 years of detention offshore. So that, you know, that's when that policy was decided upon, and people who came here by boat were sent to Manus and Nauru. And it's just a disgrace that this has been going on for 7 years. So it's important that we take to the streets every year, COVID or no COVID, whether it be in groups of 20 or in big rallies in previous years. So one more thing, I guess, is that as RAC, we're doing a bit of promotion for this in Sydney over the coming week. So if you are in Sydney and you want to get involved in RAC, we'll be leafleting train stations at peak hour and quite a few different nights this week, definitely on Wednesday and Friday. So please message me or post in the chat if you'd like to come along to that. The more people, the better. And of course, our meetings every Monday night are always open for you to join as well. So we'll have time for a bit of discussion. If you can raise your hand in the participants tab, or I'll try and keep an eye on the chat for questions as well, if you'd rather just post them with text. And I'll just try and keep everyone's contributions or questions to under 3 minutes. And I'll probably cut you off after 3 minutes so we have enough time to hear from everyone if they'd like to speak. So who wants to kick us off? I think we already had a question in the chat from Lindsay, if I can find it. Oh, so Lindsay asked in the chat, how are the locations in the US chosen? Is it on the basis of states that are more welcoming, or are there other criteria? Are some states supportive, even since COVID? So I'll hand to whoever wants to answer that, perhaps Ben.
Cool. Yeah, no, it's a good question. It's one that we get a lot. Basically, there are 9 resettlement charities who are given a responsibility by the US government for resettling refugees. Every week in normal resettlement times, they will meet together. They'll look at the new arrivals for that week, and they will divvy them up to the various cities and locations. They each run they're national organizations, but they run a number of local offices, dozens around the country. Sometimes there's 1 or 2 different organizations in each city, and they will receive and allocate and distribute the refugees kind of based on that criteria, based on that process. In terms of how they make the decision, I think it's a lot to do with their capacity. Sometimes if a refugee has expressed a desire to go to a certain city because of family connections, they may take that into account. I think they also try to take into account ethnicity and where there may be established communities of that particular group. So for example, if there's a large community of Burmese refugees or Myanmar refugees in Buffalo, they might look at a particular Rohingya and refugee and say, well, Buffalo is the best place for that. So I think that kind of consideration does go into it, but a lot of the time it is just a bit random. In terms of, it also bears mentioning that can be especially difficult for refugees who are separated from everyone and sent to a kind of remote city. So we have situations where, someone from Manus or Nauru in their early 20s ends up in some remote city in the middle of nowhere where there are no other Manus or Nauru refugees. And because the demographic profile of the refugees coming through the Manus and Nauru resettlement program can be different origin countries than what America generally accepts in its broader pool, they can be both the only Manus and Nauru refugee and also the only refugee from their particular nationality in that particular city. So it can be especially isolating and lonely for new arrivals if they do get split up in that way. In terms of some states being better than others, we find there's the capacity for states now to actually decline all refugee resettlement. So if Texas was to decide it didn't want to accept anyone, they would be able to now under Trump's new guidelines. I don't think that has happened in many states. We find that the quality of refugee resettlement is really down to the particular agency itself. And in some cities, we often hear more about what goes wrong than what goes right. So I can't tell you who's great, but I can tell you that there are a number of resettlement agencies that are quite renowned for being terrible in the level of support that they give and their kind of general commitment to refugee arrivals, and there are others that are quite good. So, and sometimes it does differ between cities as well. So sometimes a city will have a really bad local refugee resettlement agency, but that same agency in another city in another side of the country might be quite good. So yeah, we really do. It's quite random. There is a real patchwork. It's very hit and miss, and the quality of refugee resettlement generally leaves a lot to be desired, and in some cities is really, really terrible.
Thanks, Ben. So I might take a couple of people, and if the speakers can sort of just keep a list of some of their responses to some of the questions so we can get through a few in a row. So there was a question, how many people have been approved for Canada since COVID hit? From Archie. And from Maya, we had, is it true that there's an injunction preventing the media from reporting on the situation around the guard who's been diagnosed with COVID-19 at the Mantra? keep hearing this, but not sure if it's true or not. And we've also got James, who's raised.
Cheers. Like, I thought it was really right what Aziz said about the COVID-19 internationally leading to like a surge in nationalism in terms of the way different governments have responded. I mean, like we saw very early on, even at the level of the EU, you know, initially there was a lot of controversy because other EU countries were not very willing to actually help out Italy early on when it was very hard hit. You know, we even saw, I mean, we see there's like now a race about, for instance, who's going to get access to even the antivirals like remdesivir, which the US is trying to, you know, grab hold of for itself. And, you know, there was early on also like effective little bits of piracy to try and grab hold of PPE between, you know, the US and even places like France and so on, I think. And I think one of the other things that reinforces is also like the racism that we see in terms of the way that refugees actually are treated under COVID-19. And that, you know, extends beyond refugees. I mean, I think there's a very important parallel, I think, between the kind of racism that we saw in terms of the hard lockdown that was imposed on the 9 public housing towers in Melbourne, in the sense of, you know, people who are overwhelmingly refugee backgrounds, migrant backgrounds, you know, living in those places, you know, whatever, you know, in the sense that they got very different conditions, much harsher conditions to everyone else in terms of being the only kind of housing area in the whole of Melbourne that had a hard lockdown where people weren't allowed to leave even for work or for shopping, and, you know, really weren't given any notice or proper communication about that, and all sorts of problems in terms of how the government responded, you know, with adequate food and all these kinds of things. And I think there's been a huge outcry about that, you know, across the country in terms of their treatment. And I think there is an important parallel with what's happening in the detention hotels and the detention centres, in the sense that, you know, there was a description once saying that, you know, the public housing towers were like the cruise ships, you know, vertical cruise ships, because if the virus got in there, it was going to go through very quickly. And we can see now that one of the towers has got over probably more now than 10% of people in the tower actually are infected, but because of the conditions that people are kept in, living at very close quarters and shared facilities, like, it can spread through there like wildfire if it gets in. Well, it's exactly the same kind of situation in a detention hotel, you know, in a detention centre, in the same way that it is, you know, in prisons in general. And I think that, you know, the concern we've seen about, and also the, you know, like, there has been a very strong mood of solidarity amongst people in terms of wanting to support people in the towers who've been particularly targeted. I think, you know, I think we can draw a parallel with that in terms of the way that refugees are being treated, even here, you know, in Australia, in terms of the racism that says, you know, they're not going to give any consideration to letting people out even temporarily, given the kind of infection risk there. And I think, you know, that's obviously an issue we're going to want to raise on the weekend, that, you know, these people have now been in detention of various kinds for 7 years and still being kept, you know, in unsafe conditions. And that, you know, kind of, you know, nationalist and racist sort of, you know, double standards and targeting of those people kind of goes on. And, you know, the fact there's been ongoing protests there, I think, has meant that there is a focus for solidarity here in Australia, and hopefully we can build on that on the weekend.
Thank you, James. Aziz, are you raising your hand as well? Yeah, sweet. I'll go to you. I've just got Ian first. There we go.
Okay, thanks, Dave. Yeah, look, thanks. It's very nice to see all our speakers. It's been a long time since I saw Aziz, and yeah, and April and Ben. It's good, very good to see you. And it's a horrendous. It's just a horrendous story, really, and just like a big reminder about, you know, like, why we do need to fight in Australia. It's a point that Aziz rammed home in more ways than one. But even look at Australia domestically, like the measures about, you know, JobKeeper, JobSeeker, even just the basic payments to sustain, refugees and asylum seekers in the community, and some have been in the community for as long as some people have been on, on Manus and Nauru, not getting that kind of, support. So we really have got a vicious microcosm in Australia of the way in which, the most vulnerable are, systematically excluded and, are constantly, scapegoated. And we can say, well, other people have made the point about the COVID threat. People may not have caught up with the news, but there have been 30 guards in Villawood who've been stood down because they were partying at the Casula Hotel. No one's actually tested positive yet, but the number of them need further testing. But anyway, the point I really wanted to make is it is a big reminder about why we do need to fight so hard in Australia, to get people out of the hotels, to get people out of detention, to get the people who are still on Manus and Nauru, to Australia. I know we talk about safe third countries, as a fallback, but really there is a really possibility of actually fighting in Australia to get people out of the hotels, and it's been very encouraging, I think, to see the amount of protests there's been at Kangaroo Point outside Mantra. We've had a good go in Sydney, where we haven't had quite the same focus. So the hotels where we've been able to rally supporters at. But I do think there are bigger layers of people who are understanding why we need to keep the fight going here for the people who are in the hotels and also for the people who are in the community. But thanks very much to all our speakers for the absolutely solid work. I did have one little question about the US. Is it simply that is it COVID dysfunction that has resulted in the situation with the COVID crisis of being that much more difficult? Like as the resettlement services just found it more difficult to function as well, or are they being starved by federal policies? But thanks very much.
Thanks, Ian. We'll go to Aziz, and we had a couple more questions in there in the chat, so we might as well go to the rest of the speakers after that. So there was, can Aziz talk a bit about who he's been able to talk to and hopefully influence in European forums? There was one back there as well about, Ian answered to say, no, there was no injunction on the situation around the guard who's been diagnosed with COVID-19. So that one's answered. So Aziz?
Well, thank you. I just want to add a couple things of what Ben has said in regarding of the the location of the refugees or the relocation of the refugees is a start way back from the process point, which means whether you are on Manus or on Nauru, you have a last day of the orientations where on the day of the orientation, so your personal file, when the Department of Homeland Security accepted you, they will send you a file directly to the organizations that, as Ben mentioned, the 9 organizations, and then the organizations will pick the city. But then all of these processes, they start from Manus. But when you are on Manus or on Nauru, if you do mention that I do have family, or relative in that particular city, so there is a 90% of chances that you will end up in a city that where you have mentions or where your family members are, because you make a least wage on top of their shoulders. Because if you don't have anyone, so there's always like a precautions of like, we have to take care of you, we have to do this, we have to do that for you. So it starts from way back. And in terms of the Canada, well, with the Canadian at the moment, what happened was is that the country at the moment is in a lockdown. And not only Canada, but every country has declared that they are no longer going to allow any newcomers to come in, except what happened was during the lockdown. So we had like quite a lot of push, even on the European levels, like in the European Court of Justice, in the parliaments, where we kind of like, shake the countries a little bit. And then we end up seeing that, country like France, Denmark, Netherlands, and Switzerland, they went all the way to Moria, and then they got the minors, so which are like, it's not a big number, but it's only like a handful of people out of there. So with the process with the Canada at the moment, based on my last, engagement with the Canadians, immigration minister. That was back in March when he was in Geneva. So it's we had like, I mean, we talk about the time limits. So I mean, in Canada, if you're trying to send someone either from Australia to Canada, it will take 20 months. And we don't talk about the fee, how much it will cost, but the time frame, it's 20 months. And my arguments at that day with him, it was, or like my question to him was, is there any possibility that we could reduce the time? Because those people have not 20 months based on their mental health status. And he kind of not reassuring, but he said, I will see what I can do, because Manus cases and Nauru, it's been treated as in special cases. That's his own words, I can quote. It's a special cases, so which referring that the time is going to be reduced, but also there is, I mean, a less chances that we will see the time will be reduced, because we are not sure. He just said it, but there is no any written things that came out. In terms of the resettlement with the US right now, I mean, the resettlement is on the way to expire. Why I say that? Because with the Trump administration, the deal that has been signed with Obama and it extended with the Trump administration. So we have seen that high likely that Trump, government, they are going on their way to the elections, and we don't know what will happen, because the last group left Manus and Nauru, and the last group left Australia. So the last group was from Australia. It was on, I think, the end of the last month, and I'm kind of in touch with them. So there's no one again left, and there's the process at the moment are in halt completely, because based on the COVID-19 issue. And the last questions in referring to the EU. EU, it's one of the a major institutions where we have seen. We have like people divided into 3 groups. So we have groups where like 30% or 40% who are in favor of the refugees. Then we have like other 30% who are, against the refugees. And then we have the 20%, or like the other 30% who are, they are not really wanted to decide. And also they are really, the fascism things. They are fascists. So which is now we have like in major conflicts in EU here, especially when it comes to the refugees. And we have seen these days that there is a clash between left and right in each country about who will come in and who will go out. And lately also we have seen the budgets of the Frontex. Frontex is the police that they create a police unit or like a Coast Guard unit that to monitor the sea, the Mediterranean Sea. And what they do is to send their drone to check the sea, or if they capture any boats on their radar, what they do is they will send an alert to the Libyan Coast Guard, where in the Libyan Coast Guard, as you know, based on the testimony that I've heard recently, there is no, electricity, the country is turning apart. So they send a alert to them and ask them to come and intercept the boat and send it back. So we have seen lately also there is a clash between the rescuing operations such as like Sea-Watch, and then you have SOS. They have a clash with the Libyan coast. So the SOS come to rescue the people, and then we see the Libyan Coast Guard come and it's like, oh, they are ours because they are in our, territorial water. So we have to take them back. And that budget of Frontex at the moment, it's been increased, which is double the size of where it used to be. So that shows that there is no willingness of, welcoming or even any temptations of trying to reduce, take some people in Libya or even resolve the problems. And lastly, I can say also, based on my contacts, we are planning to have a kind of, a meeting in Brussels, which is with the European Parliament. And it's, kind of things that we've been planning and working on it, but I'm not sure when that will take place, but hopefully I'm expecting that there will be a good outcomes based on our preparations right now. Thank you.
Thank you. We'll go to Ben and then April. So we'll give the speakers a chance to respond to some of those questions.
Thanks so much, everyone. Yeah, Aziz is right. I can corroborate that. In terms of Canadian timelines, we expect that it will be for Manus and Nauru refugees who were submitted through a certain process and have been flagged in a certain way. It may be quicker than the 24 months. It may not be. As is mentioned, there's nothing particularly in writing, but it could be significantly quicker. It could be delayed or go back to normal because of the COVID crisis. It's up in the air at the moment. Canada, we have always tried to be very clear about, is a backup option. It's something that we view as very important to do, despite the amount of effort that it takes for each application, the amount of money that it takes, the amount of organising it takes. We view it as important because we can't rely on the Australian government to find a solution. We need backups. We need as many options open as possible. So that's how I think it's important to view the Canadian system as not an answer to everything, but as a backup option that we should try to work on as hard as possible as a solution. In terms of numbers, it's a really, really difficult question to answer. Simple question, really complex answer. So in terms of approved cases, there were 2 refugees from Manus and Nauru who very early on, like I'm talking 2014, 2015, had individuals sponsor them, and they have arrived that way. There's a 3rd one who snuck into the country, snuck out of Manus, managed to somehow get a flight, landed in Canada, went to a homeless shelter, and then applied for refugee status in Canada. He's been able to stay that way. There were 2 refugees who were supported more recently who have both arrived, one through our group and one through another group in Vancouver. And there is another refugee who has arrived that the UNHCR kind of facilitated an expedited resettlement from. So 6 so far have arrived and have been resettled. In terms of applications that are still ongoing, the group that we work with had submitted 3 before Adds Up as an organisation, submitted 6, sorry, before we as Adds Up as an organisation got involved to try to boost their efforts. And now that's up to an additional 20 through our organising of volunteer teams and fundraising. And we've also been working in partnership with a sponsorship agreement holder, which is an organisation that kind of has a special status for applying for refugee applications in Canada, and they submitted about 70 last year applications, which include the ones that we did, because we did it under their process to make it swifter, and they'll be submitting another 75 this year. They're kind of capped by how many positions that they get given. It's also complicated again because the ones that have been submitted through Adds Up have sponsorship teams in place. The way that we go about submitting it, we make sure that we have 5 volunteers beforehand, because there are various different things you have to have completed before you submit it. Whereas the other organisation is actually able to submit it before they have those volunteer teams in place. So they'll be working to build those volunteer teams over the next 6 to 20 months as those applications get progressed. We'll hopefully be building more volunteer teams and submitting more applications that way. So at the moment, that's a really complicated answer to the question, which is 6 people have been resettled in Canada so far. We're hoping that hundreds more will arrive in the next few years. And it could be anything from 6 to 24 months before we see the first arrivals through that. And yeah, in answer to Ian's question about what's the cause of the dysfunction in America, it really is all of the above. Before the Trump administration came along, there were in excess of 100,000 refugees or thereabouts being resettled per year. And that meant that refugee resettlement agencies were getting a grant per refugee to resettle them. So they, using those grants, would hire support staff and kind of build out networks and open offices and support their resettlement that way. Trump has cut that number down to 18,000 a year. So the source of funding and income for these resettlement groups has fallen drastically. And they've had to lay off staff, shut down offices, and the people that they do still have working for them are supporting more refugees than ever before. That has also been attended by other cuts in social services from the Trump administration and local governments, which have just meant that the system in effect has been decimated. So and that'll happen before COVID-19. Then you have COVID-19 come along. You have caseworkers who are already overstretched and who are really struggling and utterly failing to provide remote assistance, who don't answer phone calls, who's kind of throw their hands up and say it's all too much, I can't be stuffed. So, you know, if a refugee arrives and they're taken to an empty apartment and there's no food there, they call up the caseworker and say, there's no food, what do I do? They say, I don't know, I can't leave, I'm not supposed to meet you because of COVID restrictions and the lockdown, you figure it out yourself. So that's where we would step in and order them groceries on Amazon Prime, or try to find someone local to drop something off, figure out where their nearest supermarket is and try to get something to them that way. But yeah, so they really are failing on every level. And it's going to be a disaster in 2 to 3 months' time when that initial resettlement support that the agencies give them, they give them 90 days of resettlement support that includes accommodation. That's going to drop off a cliff in a couple of months for the newest arrivals, and they're not going to be eligible for any support unless there's a major new plan put through Congress. So we're really bracing for that when we're expecting that kind of demand for our support and financial assistance as well, to just keep people housed and fed at that very basic level, is really going to spike. So yeah, it's a bit of a dire situation.
Thanks, Ben. April, did you have anything to add to that at the moment?
Look, I think Ben articulated it very well. You know, it is a dire situation, but I mean, on the other hand, what we've seen is an incredible level of compassion from Australian expats, particularly those that have more time on their hands to help. And the Aussie, you know, community here and communities that have rallied together to raise funds and to do remote assistance from Australia, like advocating for refugees and getting on the phone to case managers and, you know, holding them accountable and making sure that support is you know, distributed. So yeah, you know, we can't do it alone, and we need all of you, no matter where you are in the world. It all makes a difference.
Thank you. We might come back to our speakers again before the end if there's a few more questions. We'll take a few more contributions as well. We've got time for probably a few more. So Mark. Oh, I have to unmute you. There we go.
Thanks, Tilly. And thanks again to all the speakers. It's been a very, very interesting discussion thus far, and very informative at the same time. I just wanted to comment a tiny bit about the Canada scheme. And I do appreciate what Ben said, that, you know, it's not a solution, but obviously it's something which people can access. And around 12 months ago, I spent maybe 2 weeks in Indonesia, and I know for them, they see no resettlement options ahead of them. And some of them are trying to go down that path as well. And, you know, you can understand it, especially when you look at, I think someone posted in the chat about the Australian Community Sponsorship Program. And, you know, the Australian system is absolutely appalling. If it's difficult and bureaucratic and time consuming with Canada, you know, the fact that if someone succeeds, they're taken out of the official quota, you know, it's far more expensive, the amount of money that people in Australia would have to raise for that scheme. And then that money doesn't even go to the refugee once they arrive in Australia. So it's not a surprise that it hasn't had much of an uptake in Australia. And just while this meeting's been happening, someone in Indonesia sent me some short videos about the destitution that's happening there right now. As we know, in Southeast Asia, probably Indonesia is the most affected by COVID, affecting Indonesian society. But, you know, they've had to close down some of the refugee-run schools that they've set up, and the level of destitution and homelessness there for those 15,000 that either didn't get on a boat before July the 19th, 2013, or who arrived on their way to Australia after that date, who are caught there for that long. And, you know, obviously we have our focus on the Manus and Nauru people in Australia, but that situation is something of Australia's making, you know, as well, and a disaster waiting to happen. I know that, you know, with this whole rise of nationalism that Aziz talked about, and James also, and the lack of resettlement, I know because I'm a teacher, there's just, you know, some of the educational services for, you know, refugees under the official, you know, refugee intake, you know, these people just aren't arriving. And I know it's not something that, you know, RAC would normally focus on, but I think if there are calls from the wider sector, or there should be calls from the wider sector, there's no reason why this official resettlement shouldn't be restarting, even if it meant quarantine, you know, 4 people prior to being able to, you know, live in the community. And it is sickening. Someone asked a question about Hong Kong. You know, obviously we defend the right of the Hong Kong people in Australia to claim asylum, and that's what they can do. Although Alan Tudge, the acting immigration minister, yesterday said they will be subjected to a character test. But at the same time, he's also saying we're going to be targeting the talent and the entrepreneurs and all this kind of thing. At the same time, in the same interview, basically saying to the people, Medivac from Manus and Nauru, their choices are to go back to Manus or Nauru, or go to the United States, or to go home, which, as we know, none of those are options, you know, for people in this current context. And you know, it just shows you how much of a fight we still have. If I can sneak in a question, I know, Aziz, you spent quite a bit of time in Greece. I know Lindsay on here has, and I have myself in Greece as well, but I'm pretty sure you also went to Turkey. So I'm wondering whether you had any experiences of, you know, going to the other side of the Aegean and seeing what the situation was like there.
Thanks, Mark. Unless we have any last minute people raising their hand, I think that was all for questions in the chat as well. There was one, I think the person who asked the question is gone, but about the LGBTQIA+ refugees in Nauru and Manus, which we know obviously as well are a group that is also subject to significant oppression in the camps. Any other questions or comments before we hand back to the speakers to wrap up? Oh, we had James as well, has just asked if, Aziz, you could talk a bit more about what you've seen in refugee camps in Greece or elsewhere. Have there been COVID-19 infections? Are they taking safety measures to try and stop this? Are refugees and migrants in Europe dying from COVID-19 at higher rates than others? Yeah, is that a question, Jill? No, it's not. Okay, cool. So I'll hand over to the speakers, just sort of some comments summing up. When you're ready. We'll go to Aziz first. So.
All right. Thank you very much, Mark, for the questions, and as well as for the comment that you make about what is happening in Indonesia. Despite I have also quite a handful of people who are in Indonesia, and I'm in touch with them on a daily basis, and it's, as you said, it's a quite horrendous situations there people are really experiencing. About Turkey, well, in fact, I haven't honestly been to Turkey because part of my plan to cross and go to Turkey, but then I had a problem with the Greeks police, so I had to leave the island because of I was not supposed to go inside the camp where the refugees are, so I stayed there and for whole half of the night, and I came out. So it's kind of like quite, you know, tricky things with the authority, and I start even filming. So that's the things I've been pushed out. But also I have the reliable contacts of refugees and migrants, Syrians and other nationality in Turkey, as well as the service providers. So in Turkey, basically, the UNHCR has stepped in with the assist of the Turkish government. They're trying to kind of keep the situations under the controls. And not long ago, what happened was the agreement between Turkey and then the EU, which is annually, 6 millions or to be paid to Turkey, to feed and accommodate the refugees. And that agreement has been kind of like being shaped a little bit by the reactions of Erdogan's when he started, airstriking in Syria, and then he asked the NATO to jump in. The NATO refused to help him. So what he did was, he went back to the refugees. He took the refugees. They put the refugees in their own trucks or cars, and then they brought them to the border, and certain amounts of refugees brought to the border, and then they locked the border with the armies that, so we brought you to Europe. They say to the refugee, we brought you to the Europe and carry on, but do not come back. If you come back, we don't let you in. And that was the first threat. And then he said to the EU, if you don't comply with what I said, I'm gonna do the second one. And the second one will be another million. So, and then the EU has to jump in again and then resolve the problem. So Turkey at the moment, what we can say, it's kind of like using the refugees in a situation of bargaining with the EUs, but as well as they are kind of keeping things under control. And also to say something else about the UNHCR role as well. UNHCR has, they're kind of playing a major roles in Turkey at the moment. But again, the resettlements, UNHCR has stopped the resettlements. And no one knows when they are going to reopen it again. But right now, UNHCR has stopped the resettlement completely all over the world. And regarding to the second question about the Greece, well, my time in Greece, and if I could talk about what I've seen and what I've witnessed in Greece, I think I kind of like need more times. But speaking from my my experience of being locked down in the detention centers, and then what I saw in Greece, it's something completely different. Because on Manus at the moment, even though we were like locked down, deprived from everything, but at least we have a place, even though it's not a suitable place to put your head down and at least have like at least an hour sleep, on Manus. But in Greece, it's completely different. There is a tiny little place in the middle way it built. It's identically as in Manus detentions. And then the rest of the space, people were just living, under the olive tree, which means you arrive today, you have no one will, take your names or database or anything. All you can do is like, you have to go and find your, a community or like, your community, so they can give you like, a tent, and then you have to go and chop down the olive tree, then try to bundle up the ground and make it like a mattress, and then you can sleep on. So there is, lack of the toilets, and the only toilets that people have is the forest. So they walked out of their place from their tent, and then they go and use the toilet, which is on the outside. So there's hygienes. In terms of hygienes, we have zero hygienes. There's no hygienes. People are living with the trash, and then the stings of the toilet that people been used around the olive trees. In terms of the service providers on the grounds, we have a handful of service providers, I can call them, or NGOs, who are trying to kind of help. But again, that help is not really enough. Because there is a clashes even lately between the Moria people of the Greeks people, like the island of Lesbos island peoples. And there is also uprising fascisms on that islands and anti-migrants, which lead up to, assaulting people like NGO staffs, assaulting refugees and blocking the roads, which is a quite, complicated situations that they are really having there. But the worst part of it, EU were trying to say, look, we were supporting Greece. We pay you money, and then Greece have to deal with these situations. In terms of COVID-19 whether any refugee has been, he's been affected or not. Yes, there is. They were, a handful of people who on Greece that had been tested positive. And imagine, there is no measures has been taken. There is no isolation. There's nothing, because you have 22,000 people who are stuck like a sardine in a tiny space, and where there's no distance measures has been, put in place. And in terms of even accessing foods, people has to stay on a line, stacking one behind each other, like just to access for their food. So if the disease is, it's just going to transmit from one person to another person. And then in times of also like the shortage of the toilets, especially like the women's are the vulnerable one who are in the higher risk because they are using a diapers. After 7 p.m.s, like the kids and women have to use a diapers at nighttime because you cannot go to the toilet because there is a zero security on the ground. People end up stabbed. 3 days ago, a guy from Congo, he's been stabbed on the toilets and he ended up dead. So they have been declared that he ended up dead. And there is a rise of like a ferociousness from the African communities on the centers, and then where people have to jump in and then try to diffuse the situation because you don't know who is stopping who. And the COVID, it's become a major issue even in Italy as well. Like Italians are not even able to deal with it. The only country today in Europe who managed to allocate and accommodate and protect the refugees during the lockdown was, Portugal. Portugal, what they did was they went out and then got all the refugees back and put them in the hotels, and they practiced the measures of like a distancing, and then they gave them like a health care free. So there's no other countries in Europe is doing that except Portugal. Even here in Switzerland, we have a few, handful of people who were in the collective, center has been, got the virus, and where end up like has to evacuate all the centers, and then they send them to in like a different places, which is out of the city. And now we are struggling to get in touch with them, which means like they lock them completely down. So overall, I can say the front line and the people who are really today are being, hit the most by the COVID-19 are the refugees. But the problem is we don't have the ability, or like, not even the ability, we don't have the authorization to go and do the medical test, whether to know that whether we have the virus or we don't have the virus. So which means we do have the virus and we are living with the virus, and we just don't know. And it's just like a miracle that people are still alive.
Thank you, Aziz.
Thanks.
Well done tonight. Thanks so much for your talks. We'll go back to, we got Ben and then April. Just wrap up. Oh.
Thank you so much. Yeah, I was taking some notes from what other people were saying and some of the questions there, and I'll just try to run through them. I think, Mark, you mentioned medical issues. We are seeing 30 to 40% of new arrivals to the United States in need of dental or medical support, sometimes quite urgently. That runs through things like heart valve issues, heart and lung issues, botched surgeries that need repairing, medication that's needed quite urgently. And sometimes it's quite astounding that it's quite simple, easy, you would think easy to get medication. It's over the counter in Australia, but it can actually be very expensive in the United States, that they have been denied for just years. And I think it really puts light to the idea that there is, I don't need to tell anyone here, but the medical situation of Manus Nauru is actually terrible. And we see that as proved by the conditions, the underlying conditions ranging from the simple to the very complex and dire that people arrive with in the United States. So yeah, and again, COVID-19 makes all of that, all that much more dangerous, because those comorbidities can seriously impact the effects of COVID-19. In terms of COVID-19, James, you asked about the situation in Europe. In America, we are aware of a handful of Manus Nauru refugees who have become infected by COVID-19. Thankfully, the ones that we know of and have worked with have recovered. But we're aware of a few more, I think, who have just tested positive. Of course, getting a test in the first place is quite difficult in the United States. The COVID-19 in America has really been hitting immigrant communities and Black and brown communities a lot harder than anyone else, like significantly worse. You'd look at the numbers of deaths, and they're out of all proportions to the racial makeup of Australia, of America. And that that really is due to systemic disadvantage. It's due to housing density. It's due to access to healthcare, a whole range of things. And often these kind of denser, poorer suburbs are exactly the suburbs that refugees are being sent to when they arrive in the United States. So not only are the support systems decimated, but the communities they're arriving into are quite decimated as well. Mark mentioned sort of comparing the Australian community sponsorship system to the Canadian one. It is a benefit that in Canada, the entire amount of money raised goes directly to the refugee themselves. It's held in a trust account for them. So we see that as a very positive thing. We can tell donors that, you know, every dollar you donate is going directly to the refugee, and we think that that's a really great scenario, and we hope that it gets back up and running, because we do have all this money that's in trust accounts ready and waiting for refugees when they do arrive. And then the final question, I think Rev Rowley asked about LGBT refugees. We're aware of a dozen LGBT refugees who arrived in the United States, and we're looking at trying to put together kind of a more tailored and targeted support program for those particular refugees. I'm gay. Sometimes it feels like half of our volunteers are gay as well. There's big support in the queer community for refugees. And so we really want to try to kind of leverage that experience and that understanding in connecting with LGBT refugees. With regards to the Canada process, it's also quite relevant there because LGBT refugees fall outside the normal caps for resettlement. There's a special program that kind of accelerates the paperwork as well. So we've been working to identify LGBT refugees on Manus and Nauru and in Australian detention, of which we know of a handful, and trying to make sure that they've got the applications in there, and trying to advocate in Canada, letting people know in other partner organisations we have that these LGBT cases, they fall outside of the cap. You don't need to kind of worry as much about the paperwork or the eligibility requirements because of that. So yeah, if you do know of LGBT refugees who haven't been contacted by ADSUP or any other group for Canadian resettlement who are still in detention, definitely get them in touch with us, because we can accelerate and push that through and they don't have to wait in line. And yeah, we do know that, you know, when it comes to emotional support, isolation, mental health issues and physical health issues, LGBT refugees are definitely facing and women as well are facing a much worse time on Manus and Nauru and in Australian detention, and that's definitely a priority for us to attend to, and should be a priority for everyone to turn their minds to as well.
Thank you so much, Ben, for that. April, did you have anything to wrap up with as well? Oh, sorry, I've got to unmute you. There we go.
Hey, it's interesting to hear about the Australian community sponsorship model, and I know that there's been a lot of sort of campaigning and advocating about trying to get an Australian sponsorship model up the ground, and I don't know how long that would take, but what's been really incredible here is to see the community groups get behind fundraising for Canada. I think, you know, most of the money that's gone towards our Canadian private sponsorship applications have been raised by community groups here in Australia. So like the Rural Australians for Refugees, the Grandmothers for Refugees, you know, holding dinner parties and getting people together. And I think that's been a really beautiful show of solidarity, but also demonstrating that there is a real willingness from Australian communities to sponsor refugees. And I don't know how that can be tied into a sort of a bigger project about, you know, showing the goodwill of Australians for a community sponsorship program like that. Yeah, and I just want to give thanks to everybody on this phone call that do so much hard work in advocating for this group of people. And there's no rest until everybody's free. So thank you for all that you do.
Thanks, April. Great. Okay, well, yeah, just to wrap up, I think it's just, you know, as Liz said it all at the beginning, to say that right through this crisis, it's been about the idea of stay home, and refugees don't have a home. So I think that's really really telling of the issue that we're facing right now, and how much borders and immigration politics play into this threat of COVID-19, and how it really does affect refugees at the front lines first, whether they're in the camps offshore or whether or onshore, or whether they've been resettled in countries and are then working jobs in, you know, service industries and industries that are exposed to the virus first. So, you know, freedom for refugees and proper work rights for refugees and rights to live and stay in Australia is something that we'll be fighting for on the weekend, on Sunday 19th. So I hope that people can try and make it along to that. If you're feeling well and you don't have any symptoms, please come along this Sunday, and please register on the form so we can sort of manage our numbers. And yeah, we'd really like people to get involved in RAC as well. If you're here in Australia and you're free on Monday nights, we have our organising meetings every Monday night, and they're open to everyone. And yeah, really useful way to develop your politics around refugees, and to also advocate and work towards, you know, freedom for everyone in the camps and onshore. So thanks everyone for coming tonight. And yeah, we'll hopefully see everyone on Sunday, and those who are in Brisbane and Melbourne, we'll see you at those rallies. And thanks again to Aziz and to Ben and to April for joining us and for letting us know about what they've been doing.